some of the simplest solutions are the most effective, and yet people don't do them. For example, with depression, one of the biggest issues is isolating yourself and not having any physical exercise, or not actually getting yourself moving physically. Because if you move yourself, then your brain starts to produce all this wonderful stuff, endokinins, endorphins, serotonin, and all the other neuropeptides. But when you're depressed, you don't want to do it. And so sometimes you have to force yourself. This is treatment. I want you to take it 3 times a week. One helping, each helping must be at least 30 minutes. And it's really difficult, but I found people who benefited so much. For example, there's this guy who couldn't get out of his couch for years sometimes at a time, and was so depressed. And all the antidepressant medicines were not seeming to work that well. And yet, when we managed to put into place a simple thing like, I want your family or your children to take you out for a 20-minute walk every day. And literally it was like dragging you out for the first week or 2.
Yeah.
But after a month of doing this, the whole attitude and whole lifestyle and mood started to change. So a lot of the behavioral changes that are needed are simple stuff. And that's just one example. In the School of Positive Psychology in Philadelphia, or University of Pennsylvania, they have a whole series of things where they talk about things that you can do to push up your mood by maybe 5%. And that's all you need, because it can be cumulative, like 3% here, 5% there. Yeah. After a while, you're actually doing pretty well.
No, and I also believe that positivity is sort of like a muscle that you learn, and how I interpret it is sort of that's a way of seeing what has happened, and it's a story that you're telling yourself what has happened to you. And if you were to create those new narrative for yourself and make yourself positive, it's a positive narrative, and then when you come back to the same situation, you would not have then this old negative thoughts. Or like that might be one of, at least that's how I see it.
So that's the basis of a lot of cognitive behavioral or dialectical behavioral therapy, where you change the